Good evening. Thank you for tuning in to Veterans Voices. We're live tonight, and we'll be talking about a veteran, and be talking with a veteran and medical experts about a new procedure called Stellate Ganglion Block. Stellate Ganglion Block is being used to treat some veterans with PTSD. We'll be right back with our first guest. Thanks for being with us. Today is October 15th, 2018. I'm Nathan Johnson, the Contra Costa County Veterans Service Officer. Our program is committed to serving the community by educating our viewers, you, about veterans issues and providing resources to vets and their families. Our hope tonight is to make television part of the solution. I'm grateful to be joined once again by my co-host, Gold Star father, Kevin Graves. Welcome back, Kevin.
Thanks, Nathan. It's great to be back.
Been a while.
It has been a while, and I look forward to learning more about this treatment.
If you're at home watching and want to join our discussion, please feel free to call us right now. Our phone lines are open, and we're always excited to take your calls. It's a great part about this show, is having people call in, ask questions, make comments and such. You can also send us an email at veteransvoices@contracostatv.org or connect with us on Facebook at Veterans Voices 1.
Because this topic is new, and many of you may not be aware of the procedure, we wanted to show you a very brief video that outlines what our discussion will be about tonight.
The U.S. Army is researching an anesthetic injection that could be key in alleviating symptoms of PTSD, a disorder that impacts hundreds of thousands of veterans. Early clinical experience with the shots, known as stellate ganglion blocks, have produced promising results, with troops experiencing near-immediate relief of anxiety, hypervigilance, and other symptoms, according to military researchers. In the procedure, doctors inject a local anesthetic into the right side of the neck, guiding the needle to the area around the stellate ganglion, a group of nerves that is part of a bridge between the brain and the body, called the cervical sympathetic chain. This chain is part of the nervous system that prepares the body for perceived dangers and regulates the fight-or-flight response. Sometimes it can become dysfunctional or activated inappropriately. The SGB injection temporarily blocks signals between the brain and the body. The precise mechanism for how this assists with PTSD symptoms is not fully understood, but the SGB seems to reset the sympathetic nervous system. Doctors who have administered the injections say they firmly believe it works, but the wider military is waiting for the results from a controlled trial currently underway before they endorse the treatment. The drug is marketed under the brand name Neuropen and costs less than $2 a dose. Most patients require just one injection, but doctors say some return for a second shot. The shot is not touted as a cure, but researchers hope it can be used to erase symptoms so that therapy and pharmaceuticals can achieve long-term improvements.
We hope you were able to follow along with that brief explanation. Now we would like to welcome to our show Dr. Colin Fernandez.
Thank you. Thanks for having me.
Yeah, Dr. Fernandez, actually, welcome back, because you were on our episode a couple months ago discussing opioids in the veteran community, and so tonight's show is just as exciting, if not more. And before we get started, tell us a little bit about yourself. Remind our audience who you are.
Sure. So I'm a pain specialist, meaning I am a physician who specialized in anesthesiology and then further specialized in pain medicine. The bulk of what I do is treating pain, but occasionally the skills that I have can be used to treat things other than pain, like the stellate ganglion block for PTSD.
So other than pain, meaning psychological conditions, is that what you're referring to? Is other than physical pain, you can also treat other types of symptoms of PTSD and such?
So the blocks which I do typically help pain, but are also used for things like vascular issues.
Oh, okay.
To affect blood flow.
Oh, okay.
Typically to increase blood flow.
I see.
So how was it that treatment was found to help with PTSD?
Yeah, that's a good question. So The stellate ganglion block was first described in the mid-20s. Since then, there have been isolated reports of people getting the block for something like pain or a vascular condition, and then having the unintended outcome of also helping with mental health conditions. I want to say that this is kind of what spurred more interest in this. And there have been kind of two waves of interest. So there was one wave of interest in the 40s, a publication in 1948 of about 500 patients who had had the block to treat mainly depression. And then we didn't really hear much about it till 2008. And that's when the contemporary interest in stellates for PTSD kind of arose again. And that was pioneered by Dr. Eugene Lipov in Chicago.
When did you first learn about it, and how did you learn about it? Did a patient bring it to your attention? Was it something you learned about at a medical conference?
So I found out about it in 2010. Actually got a call from one of our psychologists asking, do you do stellate ganglion blocks? And I said, yes. Well, do you do them for PTSD? At that time, I didn't even know that this was an indication for this procedure. Looked into it. At that time, there had only really been 4 case reports in the recent past, so excluding the cases from the mid-40s. A patient had actually asked their treating psychologist, and then she made the call.
So I want to remind our audience tonight we're talking about stellate ganglion block. It's not a new procedure, but has just in the past decade or so been used by contemporary medicine to treat symptoms of PTSD. And we would like to have your involvement. You can call in and ask a question. We have our expert here, Dr. Fernandez. We'll have other experts and even a veteran who's had this procedure done on the show. So call in or send us a message on Facebook with any questions or comments that you have.
So the research that's occurring now is privately done, is that correct? It's not through the VA, the current research.
So,
or is it?
So there's kind of 4 groups of people that I know of that are doing research. Lipov in Chicago, which is private. There are 2 groups who are doing it mainly on active duty folks. So Dr. Mulvaney out of Bethesda, and then Dr. McLean out of Tripler. And then there's one person in the VA that I know of besides myself, Dr. Alkir, who is based at the the Long Beach VA.
Is this a pretty quick, easy procedure, or are there, does it take a long time to perform? Are there a lot of risks? What kind of conversation do you have to have with a patient about preparing them for this procedure?
Sure. So the procedure itself takes about 15 to 20 minutes to do.
Okay.
The whole kind of stay in the hospital roughly is about an hour and a half to 2 hours from admission, change, procedure, and watch you afterwards. The way that we do it now, it is extremely safe. That being said, there is, because of the area that we're working in, there is the potential for bad things to happen. The 2 feared complications are that the needle would get into a blood vessel, so meaning either carotid or vertebral artery, that this would not be recognized, and that the provider would inadvertently inject the local anesthetic into a blood vessel, which would then travel straight up to the brain.
I'm being told as you're describing this, our audience is looking at some still pictures that they're seeing of possibly you or another doctor performing this procedure. So is this something that usually just one doctor performs, or do you have a whole team that?
So it would be one provider doing it, but then a team in the room. So a nurse and an X-ray technician.
And how do they, you're talking about some risks involved. What guides this procedure? What kind of tools do you use to ensure that not only that it is done successfully, but that it's done as safe as possible?
So, okay, so the image that you're looking at now is actually me at the Martinez VA doing a procedure. The kind of semicircular white thing that you're looking at is the X-ray or fluoroscopy machine. And this is a procedure which I did. So as you can see, we're actually looking at the spine in real time. You can see the needle, and then the black kind of squiggly thing is dye. So the dye tells us two things. The dye tells us that the medication will stay where we want it to. It also tells us that we're not in a place that we don't want to be, i.e. blood vessel or cerebrospinal fluid.
So how many procedures have you done for PTSD? I know you've done some for pain, but now that we have acknowledged that there may be, that there is a benefit also for PTSD, how many of those procedures have you actually done?
So to provide context, since I've been practicing pain medicine, I've done about 10,000 pain procedures. I've done 27 stellate blocks for PTSD. So not a lot, but actually more than Long Beach. Out of those 27, 23 were confirmed sympathetic blocks. So we're looking for certain things to confirm that we do in fact have a block. And out of those 23 confirmed blocks, 19 patients had good outcomes.
You said more than Long Beach. Did you mean to say more than the Long Beach VA?
Correct.
So you've done more procedures than maybe some of the more larger facilities in the VA here in California?
Well, the only other VA that I know that is doing it is Long Beach. And the last time that they reported, they had done about half what I had done.
And I assume that you're comparing results with what they're getting at Long Beach facility?
Pretty much across the board, Lipov, Mulvaney, McLean, everyone is reporting between 70 to 75% success rate.
So we have a question from our audience, and this anonymous question is asking, can this procedure be used to reduce pain such as knee pain? So I guess this is a good question because we've talked about stellate ganglion block only in its use for PTSD, but its main purpose is to treat pain. So can something like knee pain or back pain be benefited by SGB as well?
When we use this treatment for pain, it is used for a very specific kind of pain. So it's pain typically in the upper extremity or arm.
Okay.
But also a very specific type of neuropathic pain called complex regional pain syndrome. The interesting thing is, having done this expressly for PTSD and not pain, I'm hearing again and again from vets, miraculously my back pain is better, or I had someone whose testicular pain was better. And I think that points to the overlap in maintenance between PTSD and some chronic pain syndromes, which might both be sympathetically maintained, if that makes sense.
Right, absolutely. How do you know that you've done this procedure effectively? How do you know that the patient is responding, in fact, to the block?
So we're looking at a couple of things. We're looking on the X-ray to make sure that the needle is in the correct place. But more importantly, we're doing two things afterwards. So we're looking for something known as a Horner syndrome, Horner, and that is a droopy eyelid, constriction of the pupil, maybe redness of the eye, loss of sweating on half the face, and then maybe an increase in temperature of the right arm. And that's because we're blocking vasoconstriction and increasing blood flow to the arm. So all of these lend evidence to, yes, we did have a successful blockade of the sympathetic chain.
Do you find other doctors coming to you and asking questions about how you learned about this, or how you've, I mean, was this something you were just taught in medicine school and every doctor comes out of school prepared to do this procedure, or are you considered maybe now an expert in this type of procedure for treating PTSD?
So people that do stellate ganglion blocks would typically be either anesthesiologists or pain specialists.
Okay.
Both of whom typically do blockade of specific nerve structures. And so, I mean, I guess by my training, yes, I would be an expert to do stellate ganglion blocks. For PTSD, see, not many people are reporting, I think, what they're doing, so it's conceivable that there are other VAs that are doing it, or other practitioners that are doing it, and we just don't know about it.
So do you consider yourself a pioneer in the PSD side of studying?
Well, when I did my first patient, there had only been 4 case reports. So I mean, at that point, yes.
You're very humble, sir.
Real quickly, because we have just a few seconds, so real briefly, for a veteran to get to you to have this procedure done, does it require a referral from behavioral health?
Yes, and I actually insist that the patient is connected with mental health and has ongoing mental health treatment.
Great.
Before and after.
Perfect. Thank you.
Great.
And that'll set us up real nicely for our next segment, because we're going to bring on Dr. Springer, who is a former VA psychologist, and she'll add on that perspective of helping someone through the referral in the procedure and the aftercare. So we've had a great conversation, very interesting discussion so far. We're talking about stellate ganglion block. We've had a couple of questions. We need your participation really to have a full conversation about this topic, a new and potentially pioneering procedure to support veterans in healing from PTSD. Are you out there with a question on the tip of your tongue? We encourage you to call in. Be a part of the conversation. We'd love to hear from you. You can call in to ask a question of one of our guests or share an experience related to this procedure. Call us right now at 925-313-1170. Stay with us. Up next, we'll be hearing from locally renowned former VA psychologist, and she's called by veterans who know her, Doc Shauna Springer.
Welcome back to the show. Welcome back to the show, Shauna. Thank you for being with us to discuss this potentially groundbreaking procedure, stellate ganglion block.
Thank you. Happy to be here.
One of the things I was thinking about when we were talking to Colin was that in the little video we saw at the beginning of the show, it talked about how it works in conjunction with other treatment. In other words, it's not necessarily a miracle solution, but can be worked with as long as you're continuing with your mental health care, correct?
Right. So the other half of the story that Dr. Fernandez shared was that one of my patients, who is a combat medic, came to me. He was a doctor after he served in Vietnam, and said, I heard about this procedure. Can you get this for me? Not for me to do it, obviously, but can you line this up for me? And I said, I don't know. And I went to the research, which was very limited at that time. I said, you know, to my patient, it's very early days. I don't know. Do you really want to have me pursue this? And he said, you know that I've been through a lot of treatment. He had been with me for a couple of years, and he had done best practice treatment for post-traumatic stress, really worked hard in treatment, and had some symptom reduction to a certain extent, but still had a lot of hyperarousal symptoms. You know, if his granddaughter came up behind him, he would jump out of his skin. So eventually we decided the ethical thing to do was to see if the procedure was available. I trust Dr. Fernandez, we're colleagues and friends, and he is qualified to do this procedure. And so we were skeptical, and we approached this from a very balanced perspective, and we're not saying it's a cure, but we said, let's do this right. So I was with my patient before in the operating room with Dr. Fernandez, after in post-op, and I followed up with him for the next day and months after that. And that's the way we've handled all of the cases that we've done together, and that's been really important in some cases.
Does this change the definition of post-traumatic stress disorder, PTSD, or change our understanding of it? Because I know a lot of treatment modalities that are used to help veterans with PTSD are more of behavior type, are more of, based on the soul and the moral injury and, prolonged exposure. You just have to kind of numb yourself. But here we're talking about an actual physiological treatment, an injection into the neck. So if this is effective in helping with PTSD symptoms, how does this shift the perspective that a psychologist might have in helping someone who's really suffering from PTSD?
Well, I think, one of the shows that we did a couple of years ago was about moral injury. And moral injury is not the same thing as PTS.
Right.
So in my observation, what this may treat is some of that hyper-adrenaline, sort of hyper-arousal part of PTS. Moral injury, to me, feels like a different thing. But I've never used it as a first-line treatment for post-traumatic stress symptoms, and always with follow-through. What do you think, Colin?
I agree. I mean, I think so there's different ways to achieve similar things. I think some of the evidence-based practices like prolonged exposure, CBD, these, I think, eventually achieve changes in brain chemistry. I think you can do that also through oral medications. And this is just a different way to kind of achieve the same thing.
Okay.
I think our experience and the kind of cumulative anecdotal experience suggests that this will be most effective for people that are having, really somatic symptoms of PTS. So flushing, sweating, racing heart rate, all of those symptoms of arousal.
Well, we had a patient that we worked with together who had very sweaty palms. And after the SGB that Dr. Fernandez did, they were bone dry, just totally different than I'd ever felt them before. So it really kind of targeted that sort of hyper-adrenergic reactivity. He said it was like he was a muscle car that couldn't sort of like throttle down, like he was always revving, and he couldn't bring down his idle, if that makes sense. I'm probably botching it, but
It's not bad.
the concept, right, of like he's always kind of revving at a high rate, and so it just brought him down to a slower idle.
Well, I think that brings about an interesting point, too, that PTS or PTSD has a wide variety of symptoms.
Yeah.
Some less intense than others, can be just as debilitating, but yet manifest themselves very much differently, don't they?
Yeah. Yeah, I think it's about finding the right treatment for each patient, which is why we need pioneers to, listen to veterans and try the things that they give informed consent to try to relieve their suffering. There's a lot of ways to be a warrior, and one of them is doing things that can relieve suffering. And so I'm grateful that Dr. Fernandez was willing to work with me because my patients have had very good outcomes with this.
How long have you been tracking, and when was the earliest? How long ago was your first collaboration, and how long have you been tracking that? And does it wear off, or do you notice, does it help to learn a new behavior and therefore become effective?
And I want to just mention, because we have a question that really addresses that as well. And so, if I can combine both of your questions, just to include our audience, because it's very important that we have our audience as a part of this conversation. So Manfred from Facebook says, or asks, how does one track the short-term and long-term efficacy of the procedure? So combining that with your question, Kevin, how do you track the efficacy, but for how long are you able to track it before you know that the procedure really is going to be effective?
So typically, my experience anyways, is that if it's going to work, it works almost immediately.
Okay.
My experience has also been that the first time tends to work about a year.
Okay.
And then we've had some people who came back for a second. I've had one person who came back for a third. Unlike with my normal practice of pain medicine, where I'm doing a procedure and following patients long term, my role in this collaboration is just as a technician, right? So I'm coming in, I'm doing an intervention, but you really need someone plugged in with a stable rock, if you will, in mental health, who can do this long-term follow-up, because they're the ones that are typically acting as the liaison between the patient and myself.
And sometimes we've had very, very emotional reactions.
That's what I was going to
From
ask. Since
patients
it
right after.
works right away, what
Yep.
what has the reaction been from the veteran in terms of any type of relief?
Yeah, it's sometimes before the relief can come this sort of flood of emotions. I was in the post-op with one of my patients and his wife, and it was really a touching moment when the two of us were kind of able to be that stable anchor for him.
Right.
When he was very emotional and alarmed by his level of emotions. And I think, for so many years you build up these defenses, and then you go through this procedure, and sometimes when it works, it just shifts everything so quickly that can be kind of alarming in and of itself. So even though it's a positive change, it's a huge change for people. And that's why, we wanted to do it right. We wanted to have the there's a lot of standard measures of post-traumatic stress that we used, but also, knowing each patient. Like the one patient whose palms were sweaty, that became a gauge of how he was doing. He needed a repeat procedure, and that was kind of an extra piece of evidence that maybe some of the things were kind of wearing off that had benefited him at first.
I think a real concern of a lot of our veterans that get treatment for PTSD is getting hooked on pills or on drugs. After having the treatment, I know you don't want to just take people off drugs immediately, but is it a substitute maybe for or weaning people off of medication that they have been taking long term prior to the treatment?
It depends on the individual. So always with medication, the psychiatrist would make that determination, not myself, but I worked very closely with really good psychiatrists who would say, okay, let's see, and slowly taper off something to see if it made a difference. So it has been possible for some patients to slowly taper off with the help of a psychiatrist.
Well, we have just a few minutes, and what would you say to a veteran who, or maybe even another doctor or psychologist who might be considering either accepting this procedure or facilitating this procedure for veterans?
I would say it's intriguing. We have early promising results that mirror the level of efficacy of other treatments that are now accepted treatments for post-traumatic stress. Would you agree?
I would. I think I think we both came at this from a place of skepticism.
Yeah.
I think as we've done more and more, that has shifted somewhat.
Okay.
The only thing that I'll throw out there is, with medicine today really being evidence-based. What we're waiting for is hard evidence to show that this definitively does work.
Right.
So there was one randomized controlled trial published in 2016, small trial. I think the most interesting thing from that trial is, patients were divided into two groups. They either got an active stellate ganglion block with local or a sham injection.
A sham injection being
Being a needle placed with saline.
Okay.
So here's the thing. Both groups improved, and there was no difference between the two.
Interesting.
So we want to make sure that, a 70-75% success rate is not largely placebo.
Right.
Exactly.
Certainly. You want to make sure the medicine's actually working. I wonder if the procedure might just be contributing as well, though. But we're out of time. Thank you both so much for being on this, I think, kind of revolutionary episode. I don't think too many people have actually sat down and talked about this procedure in specific to addressing PTSD. So thank you both. And thank you for staying with us. We appreciate all your comments and questions. And we want to take a brief moment to tell you about our topic next month on Veterans Voices. Next month, we'll be sitting down to talk about an important topic within the veteran community and within our world today: anger in the veteran community. Let's not kid ourselves. After military service and/or serving in a combat zone, a variety of factors can contribute to coming home and feeling anger. Here at Veterans Voices, we wanted to explore this topic within the safety of our studio and include you, our audience, as a way to gain a deeper understanding of the forces at play and to provide resources for those who need them. Please join us next month when we are live on Monday, November 19th. Next up, we'll have a very brief vet on the street that we've been saving for you. Let's join Ryan to see how high veterans really want to get as he talks Space Force with veterans outside of the VA in Martinez, California. Enjoy.
What do you think of the new Space Force that they're trying to create, the new branch of service?
I never heard of it.
No? Well, they're going to create a separate military branch just for space operations.
Oh, for the new warfare? That's puppy crap. Seeing is believing.
What do you think of the new Space Force that's being created?
Space Force. Oh. Well, I think they should spend a little more money right here on our planet before they decide to spend more money in outer space. But
so they're going to change all these. The Space Force, that'll be like the Air Force, and put the words in there, and there'll be a Water Force, that'll be the Navy. They're going to change the name.
Yeah. Let's imagine it's 20 years ago and you get a call. We need you to go back up after you get home from Vietnam. We need you to go up and be part of the Space Force. What would you say?
I give it a shot. Yeah, why not?
What would you want to do up there?
I just see what it's all about and what what all it entails. I'm just out of curiosity. Yeah, it would be nice. But I know they won't pick veterans like us. We're old fogies now. So
Imagine it's 1967. You get a call. Hey, we want you to join the Space Force to go to the moon. Would you do it?
No. I stay over here with Mama.
Welcome back, and thanks for sticking with us. Now we have Rick Berth with us, who was gracious enough to join us tonight all the way from Sacramento. Rick underwent the procedure Stellate Ganglion Block, and we've asked him to be here to share with our audience a little bit about his experiences. Thank you for coming tonight, Rick. We really appreciate you being here.
Hey, thanks for having me.
Before we get into the conversation, just give our audience a little bit of an understanding of your military experience.
My military background, I was in the Marine Corps, active duty for 4 years. I got out, joined the National Guard. I was in the National Guard for another, oh boy, I gotta do math, 26,
Close enough.
21
you retired
years.
From the National
Yes.
Guard, didn't you?
Yes.
Yeah.
So, and I was active duty in the National Guard, doing various things. So.
Well, which included, a tour in Iraq? And,
Yeah, I've done in 2003, 2004, over to Iraq, as well as 2008 to 2009, an Afghanistan tour.
Well, you've certainly done your time, sir. We appreciate your service. Thank you.
Thank you.
So tell us, we've talked about Stellate Ganglion Block.
Yeah.
Our audience hopefully understands it at this point, but you're here to offer the veteran's perspective. So how did you first learn about this, and what helped you understand that this might be something you would benefit from?
Well, I found out about it through my mother-in-law. She knows some folks who love helping vets, and she turned me on to a gentleman by the name of Chris Miller, who runs a foundation up in Sacramento to raise funds to send vets, to send first responders and victims of crimes back to Chicago and have this done. Once I heard about it, I really didn't think that I was a candidate because I had already gone through CBT therapy,
Cognitive behavioral therapy.
for quite some time, as well as different types of medications and whatnot to handle my stress and anxiety and whatnot, these symptoms I was having.
How long had you been dealing with those symptoms? Had it been going on for several years?
Since first Gulf War. So I was a member of the Marine Corps then, and spent some time over there. And from that point on, from when I got home and I was discharged and whatnot, things were different back then. They didn't. They really didn't do a real good debrief with you. They didn't offer what's being offered now to vets and or current service members on active duty. So I didn't hear about this until 2017.
And you said you were initially doubtful that this was even something that would work for you. What changed your mind? What convinced you that this would help you?
Oh, nothing really convinced me. I just kind of thought to myself after reading about it and seeing that there really wasn't any bad side effects or a lot of risk to it, that I had nothing to lose. So why not? And so I went back and I did it, and I think it worked. In conjunction with my medication.
Okay.
Because I didn't stop taking it. As well as, I wasn't going through any type of therapy, but yet my wife, she's a psychologist, so I had a therapist at home who kind of kept
me on my toes.
Huh? Yeah, it was free.
Fantastic.
So she kind of, she worked with me on it.
Well, share with us in the audience your experience with the actual procedure itself, how much anxiety was involved with that, and then how you reacted to the procedure.
Yeah, well, sure, I can't say that I wasn't, a little nervous.
Sure.
Going in, I was somewhat nervous, but I got in there, got prepped, and they wheeled me right in. They gave me the local. They kind of don't knock you out, but they kind of make you feel good, right? So that you're not nervous, about this needle that you're watching, getting jabbed into the front of your throat. But anyways, they gave me the first injection, and they wheeled me out, and they observed me for about a half hour. And during that time frame, they had just kind of sat back, watched me. They asked a series of questions, and based on how I answered them, i.e. the answer and or my attitude, and just how I was acting, they could tell that it really didn't take. And so they had decided to wheel me back in and give me the second one right then and there.
Oh, okay.
They wheeled me back out after the second one, and I kind of came to or whatnot, and I was happy. I didn't feel overly happy. It wasn't like, oh, it's a miracle, type deal. But the first time that they had wheeled me out, they said, they said that I was angry, and I was twitching and whatnot. And so he had gone back. He did a little more research. And he told me because I had been this way for so long, since 1990, that it was my body fighting this, and so they decided to give me the second shot.
Was it a dosage issue, or how did they explain that to you? Did they need more of it, or was it just the procedure again?
I think they needed more of it. So to overcome what my body was doing, and that was, my body wasn't used to feeling that way. And yeah, so they gave me the second shot.
So you mentioned feeling happy, but fast forward the clock, because it's been a couple years now.
Yeah, it's been about a year and a half.
Been about a year and a half.
Yeah.
How do you feel today?
I'm not anxious anymore. And like I had mentioned earlier, I haven't had my medication for probably a month and a half now.
Okay.
But those anxious feelings, that arousal type feeling, that being on edge constantly, it's not there.
Okay.
Now there's other issues going on, but I'm going to follow up and get things taken care of. But
so are you gonna do some counseling? Is
Sure.
that what you're saying?
yes.
Okay.
Did you continue? You continued with a counselor through the whole procedure, or were you?
No,
Oh, you hadn't been with one prior to that. You were getting your treatment at home. I remember. Now.
Yeah, I was getting my treatment at home because I was retired, and I went back to Chicago, and I paid for it, for my flight and my lodging, and everything else was on the house, and yeah.
Now you've been involved in some fundraising for this since, so that tells me that you're now part of the effort, or it must be important to you to some extent, that other veterans find out about SGB, Stellate Ganglion Block.
Yeah.
Tell us a little bit about, why have you continued this role after just having the procedure and feeling better? Why is it that you're still involved in the fundraising?
Well, I'm not saying that it's going to work for everyone, but it's got a pretty good success rate. 70 to 75% of vets, or patients, it works, and it's not invasive. There really is no side effects, and it's out there. So why not try it? And it's offered to vets, and there's some studies going on in active duty with it, and there's studies going on with the VA, and then there's like the private folks that are also doing it. And so it's out there. There are people that care about vets, and I care about vets, and I'm one of you guys. And I just want to see, more and more vets learn about this, and,
So this
Take a
is
chance.
interesting. We just got an anonymous email that kind of falls right into this category, and it's, would you recommend this procedure for a relative or close friend? Because that's a telling recommendation there.
yes, I would.
Wow, that's great.
So both of my brothers, they are prior service Marines. I'm a prior service Marine. I have a nephew who's currently back at Parris Island. He's on the drill field. I would definitely recommend this procedure to him.
And if you would recommend it to them, what words of wisdom, as in a sense, a mentor, someone who's gone through the procedure, what would you have for them to help them deal with any type of doubt, that this really is something that is a true medical procedure, or to deal with any type of fear about having a needle stuck into the side of their neck? And maybe not just a fear about the physical procedure, maybe there's a fear about what they might lose in terms of control.
Yeah,
Maybe they won't have that edge any longer. So
Well, there have been studies, I've read some articles about SOCOM doing this. And SOCOM is treating their operators.
Special Operations Command.
Correct. And they actually say that it resets that fight or flight, mechanism in you. And they're actually, the reaction time is quicker now for them.
Okay.
So they're not going to lose that fight or flight. It's going to get better. And
For some people, they think that it actually enhances their ability to do their job, be a soldier, for example.
Correct.
Yeah.
Correct.
And what about any kind of doubt about, about this? How would you address that in terms of how to establish trust with your doctor or with your psychologist that they're really doing this procedure for your best interest?
Well, it happened with me pretty quick, and I didn't talk with a doctor back home about it. I talked with a doctor out east on the phone twice, who ran me through a series of questions, and he didn't get too personal with me, but he kind of wanted to know, hey, what's going on with you? What have you gone through? Have you done the CBT? Are you on medications? What medications have you tried?
Yeah.
And so they kind of get a background, and they're going to tell you, honestly, if it's going to assist or not.
That's good. They'll let you know.
Yeah.
So you can make the decision yourself.
Yeah.
Rick, thank you so much for being a part of this conversation.
Thanks
Thank
for
you
letting me
for sharing your personal experiences of having served in combat and how you really were hurt by those experiences in the sense of the effects of PTSD. So appreciate you. We're out of time for tonight, though. People can hopefully follow up with you over Facebook and ask more questions. So next up, Kira Cerna had a chance to sit down with Air Force veteran Archie Smith to talk about his military service and the ways in which he continues to serve. Enjoy our A Vet's Voice segment.
I'm here with Archie Smith, Air Force Gulf War veteran, and today we're just going to have a conversation and get to know him a little bit. Hi, Archie. How are you doing?
How are you doing?
I'm doing good. Tell me a little bit about your time in the Air Force.
Well, in the Air Force, I served from 1996 to 2000, and I was a weapons loader, which basically I loaded bombs for a living, and that's what I did. We were in Mountain Home Air Force Base in Idaho, and we would go to the desert maybe every year, basically, when we were out there. And because of that, I think, you come down with certain exposures and certain things that you don't really know what's going on, and you're so busy doing your own job and making sure you're not putting your job on anybody else that you're not really complaining, Right. So you kind of go through your service just getting by, and I ended up having a failed knee surgery because, like I said, I wasn't complaining. And then I had an option of either staying in or getting out. So I decided to get out, and I think that it was the best choice for me because it led me to my career choice, which was helping veterans kind of understand their claims and their benefits.
And who are you doing that with? Who did you start working for when you got out?
When I first got out, I started with the Disabled American Veterans. It's a nonprofit organization. They lobby Congress for veterans laws and benefits, and they also have chapters in the community where they get together and do things for the community to uplift the community and to make, veterans and community members aware, of what's going on in their areas.
That's great. And I know they're a very well-known organization. What were you doing? What did your job entail?
When I first started, I really was going in there to file my claim for benefits. And the supervisor at the time said, you're very passionate and you seem like you know how to speak, so would you like a job? And I was like, I'm
That's great.
Right, this is great. Okay, so I started off as what's called a transitional service officer, and what they do is travel to the bases and do the out processing, or they call it a TAP briefing.
Right.
So I would go to Mare Island, Coast Guard Island, I would go to Navy Air Station Lemoore, and I would do Petaluma, Marysville, and I would do the final out presentation. And it's like a 45-minute, briefing about what their benefits are when they get out of the military, that you're about to turn and be a veteran now instead of an active military member. And then I would go through their service medical records and actually advise them on what they should file for when it's time.
That's perfect. So you would actually bring the services to them as they were getting out. And by TAPS, you mean the Transition Assistance Program?
Correct.
And were you doing that for all the different branches or just on Air Force bases?
Yes, we were doing it for all different branches. The majority of branches out here are the Air Force bases, Travis, Marysville, but we have Coast Guard Island, we have Coast Guard here, and we have Navy at the Navy Air Station in Lemoore down south. So I was getting to get all of the services and, you know, I don't know how many presentations and service medical records that I went through, and I continued to do that even when I got hired as a national service officer for the Disabled American Veterans.
Okay. And what did you do as a national? Were you doing the same thing just on a national level? Were you doing something different?
As a national service officer, your job is to do the transitional part as well as represent a veteran all the way to the Board of Veterans Appeals level. So that's where I went through the training to become an attorney, in fact, for the Disabled American Veterans, where you have the actual, you know, representation rights to represent a veteran and their family before the Board of Veterans Appeals.
Now, that sounds like it can be pretty stressful. How did you like doing that job?
I loved it. It was one of the best things that ever has happened to me, because I was able to understand things that I needed to help myself, and then really learn how to put those things in context to where I can get someone else to understand them. Because a lot of the things that we read are just so, I don't know what this is, you know. Confusing is a great word. So you're just sitting here like, what am I reading? Let me just submit this back because I don't know, and let me just sign it, and let's just keep it pushing.
And that can be so overwhelming for veterans who are trying to do claims themselves and maybe don't realize that there are people out there to help them or are afraid to reach out for help. It's very overwhelming.
Yes, and you end up just saying, you know, I'm just going to keep putting this in until it's over, you know, and they're going to grant me eventually, and that's really not the case. You have to provide the proper evidence, you know, write statements, understand what your disabilities are, understand what the criteria is. So I was with the Disabled American Veterans until 2012. My disabilities themselves became so bad that I had to stop. So I actually only had like 8 years left, and I would have been able to retire. But I had to stop early, and I just started volunteering after that. You know, I would go to, I was already a member of the DAV, the chapter 21 in Vallejo. So I was already there helping veterans and being a volunteer service officer, where you go to the chapter meetings on the weekends and just support whoever's there who needs help with the claim and give them advice. So I was already doing that.
So you were kind of doing the same thing you were doing while you were working. You were just doing it for free as a volunteer.
Yeah, because I mean, it was just so many years of that in your brain that you couldn't get it out.
You must have just loved it.
I couldn't get it out. I was at the supermarket and I'm like, what am I going to do? And I see this veteran with the hat on, and then he's limping, and I go over there and I start talking to him, and all of a sudden I help him with his claim, and I'm like, I can't get rid of this. I'm not going to be able to give this up. So I just started volunteering, and I'm a member of the American Legion in Antioch, the VFW in Brentwood, and the DAV in Vallejo. But I'm also...
your VFW shirt.
Yes, I have my VFW service officer shirt on, and what I really wanted to talk about today was the fact that, you know, how I said that. Yes. I'm a member of the DAV in Vallejo and the Antioch American Legion and the Brentwood VFW. That kind of sounds like I'm not really dealing with everybody. And that's kind of what our issue is as veterans and as service organizations, is we're kind of caught up with, I have to do this with my group and my organization, and then you guys can do this with your group and your organization, and we could be in the same building, but we still need to do this separately because, and I don't really know why. You see what I mean?
Yeah, I've seen that in the community, I have to be honest.
And when I look at the fact that, you know, my knowledge extends a little bit further because I had to explain the paperwork to everyone. And when you look at, it's called a power of attorney form. It's where you sign over your rights to have a service organization represent you for free. Okay. On the back of that form, there's a list of all the service organizations that you can choose to represent you. Back when I was working, there was like 35. So I started to think about that. And then we went to lobby Congress. Every February, we go, all the service organizations that are chartered to lobby Congress, they go to the Congressional Hall. And they actually lobby Congress. So I'm actually sitting in there with my DAV hat on and just really just overwhelmed at the volume of people, the volume of veterans, Congress sitting up in front, and we were all in line, but we were all talking about the same laws separately. So the DAV would lobby Congress for 30 minutes, talk about all of the things we want to change. Then the VFW would go, then the American Legion would go, and so forth. And I saw a divide that didn't need to be there.
Okay.
And when you think about it, if Congress says your membership strength is what we use to determine if you have enough power or voice to change a law that we put out.
Right, that's very important.
Right, so it causes the service organizations to kind of battle for membership, when we really need to be advocating so that everyone knows and everyone can join.
Thank you so much for all of that information and for getting that out there. And thank you for continuing to serve the community.
Yeah, no problem.
And helping veterans with their claims and just educating people. Really
Yes.
appreciate it.
No
It's nice
problem.
talking to you.
Thanks.
Now we would like to take a moment to recognize the military service and ultimate sacrifices of several of Steve Burchek's friends whom he served with in Vietnam. As you may know, Stephen is a highly valued member of our production staff who visited the Vietnam Memorial in Washington, D.C. in September and made graphite rubbings from the names of 5 men that were lost in his unit while in Vietnam. Stephen and his friends served with D Company, 2nd Battalion, 8th Infantry Regiment, 1st Infantry Division between 1968 and 1969. Those courageous men's names who were lost are PFC Willie Gene Cooper, Spec 4 Frederick Eugene Rouse, Private First Class Richard Saines, Private First Class Ray Gene Wilson, and Sergeant Robert John Olakainen.
We hope you've enjoyed our show tonight. Before we go, we want to direct you to a few events and resources.
The National Center for PTSD is the world's leading research and educational center of excellence on PTSD and traumatic stress. Visit ptsd.va.gov to learn more. The Concord Vet Center welcomes home war veterans with honor by providing quality readjustment counseling in a caring manner. Vet centers understand and appreciate veterans' war experiences while assisting them and their family members toward a successful post-war adjustment in or near their community. Contact the Concord Vet Center at 925-680-4526. The Contra Costa County Veterans Service Office is able to provide support for filing VA claims and answering benefits-related questions. Please contact them at 925-313-1481. And the National Alliance on Mental Illness, or NAMI, provides support, outreach, education, and advocacy to individuals living with and families affected by mental illness. NAMI has been assisting people and families affected by mental illness in Contra Costa County for over 30 years. They offer peer-based support to family members who are caring for a loved one with a mental illness. All of NAMI's programs are free. Contact NAMI.org to learn more.
To rewatch tonight's episode, check back on our homepage later this week or check your cable provider's schedule for rebroadcast times. You can also watch this episode and many others on our YouTube channel, Veterans Voices of Contra Costa, so be sure to subscribe. Our next live broadcast will be Monday, November 19th at 7 p.m. Be sure to tune in. This is Veterans Voices of Contra Costa County signing off, wishing you all a relaxing evening. And for the veterans out there watching tonight, hua and ura.